and welcome to the Illuminating Immunity Virtual Summit. I'm your host, Dr. Joe Doduro. My guest today is Dr. Angela Domínguez Camacho. She currently works at the School of Dentistry at UNICOC. She's the professor of postgraduate programs at the Institución Universitario Colegios de Colombia, Cali, in Colombia. She does research in cell biology and low laser therapy in orthodontics. She's moving the field forward in the COVID and photobiomodulation research with practically 30 papers published in the field of laser therapy. She has recently won the Rula Awards from India for innovations in her scientific research. Thank you for attending today, Dr. Angela.
Thank you. Hello, everybody.
Hi. How did you get started with your research in photobiomodulation therapy or lasers?
I started 20 years ago. I began my practice in orthodontics with laser. And in that time, we didn't know how laser works in orthodontics. So I began my research in vitro studies. And after that, in cohort studies and randomized clinical trials. And this year we published our first systematic review about this topic. So I am so interested in laser in orthodontics.
In orthodontics, and
yes.
You know, as I said, I'm a chiropractor. I'm not a dentist, but I play one on TV. But the thing is that your Colombia is not a hotbed or a full place of people doing laser research compared to other countries or other institutions. You sort of are a pioneer in your country for this topic and studying the mechanisms and such, right? And so how did you get involved with, how did you get your first laser? How did you start to work on patients with this?
I just bought my first laser, and I began to see that my treatments go faster and without pain, but we don't know how. So maybe 15 years ago, I began to teach in other university, in Del Valle University here in Cali. And I was teacher of biological movement in orthodontics.
Wow.
So I thought, okay, this is an interesting topic. So I began my research, but without resources, and for a Latin American researcher, is so difficult to publish. But I'm here now, and I have a lot of papers.
So think about that. 30 times you did it. It's very difficult, but you did it almost 30 times.
It's so hard.
Yeah, so I can say, I can tell by the flavor of the conversation that you have a deep interest in clinical research, and that you've published this. Now you have focused. You kind of had a calling to write about the transdermal application of lasers and photobiomodulation in COVID. How did that get?
Yes.
What was the seed? Because that came out very, very quickly, that paper. Tell me about that.
Okay. Despite I'm not a doctor in medicine, but an orthodontic, it seems to me that we can use laser in three specific points that laser is useful. Laser is useful strengthening your immune system. It reduces oxidative stress to improve superoxide dismutase, and it's a powerful anti-inflammatory.
All right.
So it's that I know. So my papers were to focus in invite other researchers in this topic because it seems so interesting to me.
Excellent, excellent. So let's go to the slides. Can transdermal photobiomodulation help us at the time of COVID-19? Go ahead.
Okay, the complete presentation?
Yes, ma'am.
Okay. Well, this is my presentation, and I'm an orthodontics from Colombia. And what happened? Where is coming from transdermal photobiomodulation? It's from ILIB. This is the acronym for intravascular laser irradiation of the blood. It was born in the early 1970s in Russia, but intravascular. This topic was evolutioning through transdermal low-level laser therapy. And now we think the correct term is transdermal photobiomodulation. What is that? We are looking in any of these modalities, photobiomodulate the entire bloodstream to have an effect at the systemic level. It takes just 30 minutes, which is supposed to be enough time for all the blood to receive light and allow a systemic effect. You can use a bracelet, but I don't use it. The components of the blood, that is blood lipids, platelets, the immune system, and red blood cells are the main targets. So what are the advantages? First is a non-invasive method, as any in photobiomodulation. You have to use continuous and direct application in the region of the radial artery here. And this technique improves immunity and microcirculation. Due to the proximity to radial artery to the skin is so superficial, you don't need use intravascular laser, just transdermal. So it's not invasive. We are now in a COVID crisis. We have some consideration, some global consideration. Firstly, the immune system, the oxidative stress, and inflammation. And we can go through these three topics through laser. In which form? We have to pay special attention to three possible effects that could help us when we apply this therapy in patients with COVID-19. First, strengthen the immune system, increase the production of superoxide dismutase, and control of the cytokine storm. The first, strengthen the immune system. Well, we know that laser is useful in several kinds of diseases. For example, multiple sclerosis, asthma, allergic lung inflammation, chronic obstructive pulmonary disease, oncological patients, chronic spinal cord injury, and diabetes. Also, we can improve the neutrophils through the phagocytic activity and T lymphocytes. So we have a specific effect in the immunitary system. Laser increase the production of superoxide dismutase. We have to remember that it's an antioxidant enzyme. It appears before DNA or cell membrane is damaged. We have here the principal idea in this item. The radiation of the blood by the red laser leads to an increase in metabolism and the synthesis of superoxide dismutase, which is the regulatory protein of the body's oxidative system. One of the main functions of this enzyme is protect cells against mutation through the reduction of reactive oxygen species. So it's so useful, the laser in this topic. The last is the control of the cytokine storm. We know now that patients with COVID-19 have an increased level of this kind of inflammatory cytokines. And this cytokine storm conduced to hyperinflammation and severe respiratory failure. So what is cytokine storm? It's an overreaction of the immune response. This term has been associated not only with COVID-19, but with multiple infections and non-infection disease, and laser is useful in this disease. So we can think that laser is useful now in COVID-19. Some COVID-19 patients may have cytokine storm syndrome. We must consider that acute lung injury is a common consequence of a cytokine storm. The damage caused by the virus could be mitigated with adjuvant therapy that reach all organs, logically with a special interest in the respiratory system. We know that laser between 700 and 1,000 nanometers respectively have the potential to reduce lung inflammation and fibrosis, and hence acute respiratory disorder syndrome, a major case of death in every coronavirus pandemic, including the prevalent COVID-19 pandemic. So what is the protocol? It's the most important. So you can use either visible or infrared laser. It takes half an hour in the radial artery. The total energy that you need is 180 joules, and the power is 100 millivolts. You need to use between 3 and 5 consecutive days. It's not necessary to use bracelets that attach the laser pointer, as in these pictures. So it's an interesting topic to me. I published these quick papers early in the pandemic. The first was in May and the other in June. And you can look at these papers if you need more reference about this topic. So I would like to invite you or all the researchers around the world to research about photobiomodulation therapy to carry out the randomized clinical trials that lead to the validation or improvement of this kind of non-invasive treatment. So thank you very much for the opportunity, and this is my contact.
Well, that's great. And you have no idea how hard it was to find these things in your references, but here they are all for us. So thank you so much for this initiation, if you will. But can we go back a couple of slides, if you don't mind?
Okay, of course.
Go back a little bit more. One of the things that we're one more. I really like that one of them. A couple more. This is so beautiful. So I didn't back the one here about the immune system. I wanted to grab that, but you're pointing out that one more at two more before this. This one. Now, to strengthen your immune system. I want to look at that one while we talk. The next one, this way. So you're pointing out that the application of laser to the skin is actually working on the blood vessels. And that's one of the points that you're making, two different things. That remember, we talk about a target application and then a direct effect and an indirect effect. So let's say I'm putting it on the wrist, and I might have less inflammation in my wrist and more circulation in my wrist, but all the tissue that's being, influenced by the laser is kind of, the blood is in there too. So we have a number of people in the COVID summit that spoke about this. So I would reference you to Franciscus Kokos on intranasal blood irradiation.
Yes, intranasal and intracranial.
Yep, I mean, and that's kind of what we're looking at, is you have a direct effect. Let's say if you put it over the lungs, if you put the LED pads or laser over the lungs, you have a direct effect on the tissue underneath there, but then an indirect effect by all the circulating tissues. So I wanted to clarify that. Do you think it makes a difference in if it's? You said there's really no difference between laser and infrared or red will have a similar effect, right?
We have studies in both ranges. So I can tell you which is better. I think infrared. I use infrared, but Russian has studies with visible lasers. So, and the artery is so superficial. Correct. So it's possible to get the artery through visible and invisible laser.
Wonderful.
But now, I don't know which is better. I think infrared. I use infrared in almost everything.
All the people. And there's, we have some people coming on that the new researchers that are going to be explaining their case reports and case series. And Frank in Kokos has a case series of about 4 people with COVID that actually got better. And so it's simple, but we know that it works for all those things that you talked about. They were the anti-inflammatory, antioxidant, and what was the last one?
And strengthen the immune system.
Overall. So,
and increase the oxide nitric.
Nitric oxide.
Nitric oxide.
Because that can be both a local and a distant type of positive application.
Yes.
So what sort of feedback have you got? I did not have a chance to read your response. What sort of feedback have you got in the last May, June, July, August, 4 months after this paper has come?
Okay, some people in Russia write me. They are interested in research with me, but I don't have patients with COVID. I can't go in a hospital and please, I need to research. I can't. So I don't know, but different people send me, okay, we are beginning to research through this topic in French, in
from France.
There are some group study about this topic, but researchers commonly are so closed in their research because they don't want anyone else published before there. So I don't know what are they doing, but I know people are working on this.
Correct. And I think that if something is going to move forward, it's going to be from the researchers in this group. So I thank you for your joining us and keeping an eye out on what's happening in this field. And I bet you there's going to be a good circulation of this information within the group and within the people, the attendees. So
okay, thank you very much.
Thank you.